In Ghana, abortion is highly stigmatized despite relatively liberal laws, and unsafe abortion remain a leading cause of preventable maternal deaths, with statistics indicating that between 4.7 to 13.2% of maternal deaths attributed to unsafe abortion. Dr. Paulina Clara Appiah is the Deputy Director in charge of Public Health at the Bono East Regional Health Directorate. She shared with Joy News the regional statistics in terms of unsafe abortion.
We know that abortion is one of the major causes of maternal mortality. And for our region, last year we recorded for the mothers who died, 5% of them were from unsafe abortion. And I think it tallies with national and then even international figures. Internationally, it's about 4 to 13%. So for our region, if you are doing 5%, then it's quite high.
To help address this worrying menace, Regional Health Directorate, with support from partners, held a stakeholder meeting in Techiman to create a platform for harnessing the opinions of stakeholders towards finding lasting interventions to abortion-related deaths and its related challenges.
What we are doing is we are engaging our various stakeholders. We are not engaging large groups together, but we are engaging group by group. So what we've done is that we have engaged our health workers ourselves. Because health workers, sometimes we can even stigmatize against each other. The person who is in the facility providing the service, others who are not providing the service may even stigmatize that person. So we also engage our health workers. And now we also engaging our the institutions, as in the heads of department, RCC, then also the hairdresser association. Where people are vulnerable. So that's what we are doing now.
Alontihema and acting Queen Mother of the Techiman Traditional Council, Nana Yeboah Ashiama, charged parents to provide sex education to their children at tender ages to help reduce teenage pregnancies in the area.
Okay, what I have to say is that teenage pregnancy become rampant in our area. Education goes to the parents. We should educate the children from childhood, not that we shouldn't allow them to grow before we tell them don't do that. We should educate them when they are young so that they will not get into that situation. We should provide them their needs so that they won't go and take, or they won't go to a mind to provide them such things.
She, however, assured that Queen Mothers in the various traditional councils would be sensitized on the need to educate the masses on the effects of unsafe abortion.
We normally meet at the end of the month, so some are under communities, the queens. So I will inform them to educate their children, especially ladies. They shouldn't do abortion, assuming they didn't listen to advice and something like that scam. They shouldn't allow them to go and take some concoctions which is not good for them. They should come to the hospital health center.
Dr. Paulina Appiah wants people in need of safe abortion to walk to the various health facilities for the service as a means of reducing maternal deaths across the region.
What we have decided to do is to be able to institutionalize abortion such that anybody who finds herself with an unwanted pregnancy will be able to have access to the safe abortion. The abortions that happen, most of them are unsafe and they cause so many deaths. We want to make it in such a way that the person can just walk in, like you are walking into to an eye clinic in the hospital or walking into a dental clinic. You can also walk into for comprehensive abortion care.
Anna Sabit, Joy News, Techiman.